Good afternoon, everyone. I'd like to thank Mashable, the sponsors, and all of the participants in today's events for what I believe will be a really fantastic day today. We're all here today because we care about sustainable development for all of the world's 7.5 billion people. We're here today because we also believe we need to do more. I believe we're also here today because none of us can make the progress needed alone in order to really help to achieve those goals. But I really believe that with partnership, with innovative and creative partnerships, and by applying innovation to our thinking and our activities, we can really begin to move the needle in what we do. So I'd like to, in the course of the next 7 minutes or so, if I manage to stick to time, share with you some examples of work that we have done in our business to really try and capture those elements and to work that through in the real world. I have the privilege of leading Pfizer's Essential Health business, and our vision is to make a meaningful difference to global health by making Pfizer quality medicines accessible to patients around the world. And the examples that I'd like to share with you, I hope will give you a flavor of how we've tried to do that in an innovative and creative way, and every single one of them in the spirit of partnership. I'd like to start by telling you a little bit about a story about a product called Sayana Press. This is an injectable, long-acting injectable contraceptive. Now, the reason I believe this is so important, not the product, but actually what it does, is that we all know that maternal mortality remains too high in many, many countries around the world. We also know that many women do not have access to contraceptive choices in order to help them be able to plan and space pregnancies that we know are so highly correlated with reducing maternal mortality. And we had a long-acting injectable contraceptive which, along with two partners, two non-traditional partners, the Gates Foundation and SIF, the Children Investment Fund Foundation, we developed to make it available, this product available at $1 a dose to women in something like 20 developing countries. We launched that program back in 2014, and since then we've been able to manufacture and supply to those countries around about 6.5 million doses. And in fact, earlier on this year, we extended that partnership and were able to, as a consequence of having further commitments to volume, lower the price of that product to 85 cents. The point I wanted to make in this example was we would not, as a pharmaceutical company alone, have been able to accomplish either the development work and certainly not the distribution in that last mile to be able to allow women in developing countries to have access to this as a choice for contraception. And that, to me, is one of the sort of themes which I'd really like to draw out in all of the examples of the mile, to be able to allow women in developing countries to have access to this as a choice for contraception. And that, to me, is one of the sort of themes which I'd really like to draw out in all of the examples that I talk about this morning, is we are able to do things together that none of us can do alone. So the success of the Sayana Press partnership with Gates and with SIF led us to also think or ask ourselves a question about what we could do in other parts of the world and in other areas. And we are working along with PSI, Population Services International, in Vietnam and Myanmar to look at another one of the Sustainable Development Goals, which is to reduce the impact of NCDs, or non-communicable diseases, and premature deaths from those by about 1/3 by 2030. Now again, if I took these two examples, one of the things that we begin to see in many countries where some of the challenges of infectious disease, if not having been solved, are certainly massively reduced in terms of the impact on mortality. So we see the rise of chronic disease really begin to impact health outcomes for many patients. And in Vietnam and Myanmar, we see a very high incidence of high blood pressure leading to stroke. So along with PSI, we are developing a program called Healthy Communities that aims to build capability, sustainable capability, by training healthcare professionals in the importance of how to diagnose and then to manage high blood pressure and cardiovascular disease. We're aiming in total to be able to screen around about 500,000 patients in those two countries who are particularly at high risk of cardiovascular disease. And that is something where we're aiming, again, by partnering together to improve access to important essential medicines to manage high blood pressure, but to do so in partnership with a partner who simply has scale and feet on the ground that we do not have. We can accomplish something together that neither of us could accomplish alone. The next example I would like to give you, turning back to sub-Saharan Africa, is another example in a different disease state altogether. And in sub-Saharan Africa, we've seen such incredible progress with the reduction in deaths from infectious disease, from HIV, from malaria, from TB over the last 30 years. Fantastic progress. And yet, as we've seen deaths from infectious disease decline, we've begun to see more and more patients begin to suffer from diseases that perhaps they would not have had previously. And cancer, actually, surprisingly, in sub-Saharan Africa is a real problem. There is incredibly undeveloped infrastructure, healthcare infrastructure in the area of cancer and oncology. And many, many patients either go undiagnosed or certainly untreated. And so we are partnering with this program with the American Cancer Society and CHI, the Clinton Health Access Initiative, across 16 countries in order to be able to improve both capability in the training and development of physicians, healthcare professionals, treating and managing patients with cancer, but also to improve access to 11 essential cancer medicines for patients in those countries, including chemotherapies. Again, an example by partnering with others to be able to do something that certainly we alone, but none of us alone, could actually do. And the last example that I would like to give you of a non-traditional partnership actually comes from Kenya. I had the privilege of visiting Kibera, which is an incredibly underdeveloped community as part of Nairobi. 2.5 million people live in Kibera in conditions of really incredible poverty for many people who live there. But I also had an incredible privilege 2 years ago when I was there to meet a number of women who band together in savings groups and to save together for emergencies in their family setting. Often it may be the illness of a child. And so their saving allows them to be able to have access to funds to be able to pay for a doctor's visit or treatment when they need it. And that is something which would be very typical across many African and other communities. But one of the other things that we saw in Kenya, which is unique in some ways, is the universality of phone-based banking. And Safaricom, who I think are speaking later on in the agenda today, have really been the initiator of that work with their system that they call M-Pesa. It's their phone-based banking system, which I believe in Kenya has something like 40 to 50% of all of the GDP of Kenya flows through that telephone banking system. So it really has democratized banking. And so in partnership with Safaricom and other partners, we are really looking to try and answer the question as to whether that platform, that telephone-based banking platform that is so ubiquitous, could be combined with what we know is happening in communities anyway, and to create a dedicated health wallet, which we're calling MTIBA. So the Pfizer Foundation is partnering along with Safaricom in order to be able to provide access to the MTIBA platform and allow women to be able to save using a platform that they know to be safe and reliable and is well accepted across the community. And our hope is that MTIBA may also create an opportunity for other partners to be able to put vouchers or funding or discounts on that same platform so that when a patient has need for a particular intervention or healthcare, that platform would be a vehicle to be able to target aid to a particular area of interest. So overall, I think the point that I wanted to make here is that partnership is incredibly important for all of us, no matter the passion and the drive and the desire that we have to make a difference, and whatever capabilities and experience you or I or our organizations may have. It is very unlikely that if we really want to make real progress with the Sustainable Development Goals, that we'll be able to accomplish that alone. But I really believe that with non-traditional partnerships and by everybody bringing their best intentions and common focus on what it is that we're really trying to accomplish together, that we can do things that none of us can manage to accomplish alone. So I'd just like to close by saying that if any of you have ideas or needs that you see that you would like to discuss further, please contact us. We would love to hear from you. And I really hope that this conference really allows us to be able to have the kind of conversations that perhaps in all of our day jobs we may not be able to have, and be able to, as a consequence of the discussions that we've had today and of the thinking that we have heard shared today, that we may be able to meaningfully begin to accelerate progress to goals that are so important for every single man, woman, and child on this planet. Thank you.